Good morning or good afternoon. I'm Monika, and before I start, I just want to take this opportunity to thank you 1000K cohort for organizing this webinar and giving me the opportunity to showcase Qatar Biobank laboratory quality standards, journey and implementation. The presenter has no conflict of interest or commercial bias to declare in relation to this presentation. Objectives for today's presentation will cover: list the benefits of accreditation and quality standards in laboratory management, discuss the significance of quality assurance and quality control in routine laboratory practice, distinguish the process validation from process verification, and list the parameters. Our content for today will start from the introduction of the concept of standard, guideline, and regulation. Then we will show you our certifications and accreditation and how we implement it and how we are monitoring quality control and quality assurance in our laboratory. And we will end with fundamentals of laboratory process and method validation and verification. As a biobank laboratory, we collect, store, distribute biological specimens for research and diagnostic purposes. It is crucial that we maintain the highest standards of quality in our work to ensure simply the accurate and reliable results. To achieve this, we need to follow the set of standards and guidelines. This structure of quality management system you had a chance to see in previous presentation presented by my colleagues, Ms. Eiman and Ms. Noor. For the quality standards I am going to focus today, it will be our quality implementation and quality fundamentals needed to run a successful laboratory. But before we move to the detailed explanation, I would like to introduce 5 terminologies often used in relation to quality. Regulation, it's a regulatory standard written by a national government. Standard, there are requirements for regulation of the processes and they are recorded in the document. It's basically telling us what to do. Guideline, it's describing how to implement the standard requirements. So it's telling us how to do it, how to apply the standard. Accreditation is a process which then authoritative organization give a formal recognition to the laboratory that it's competent to carry out specific tasks. And certification, it's official recognition that an organization has met a specific quality standards and criteria. In this table, you can see what are the most common standardization and international bodies. So ISO is the International Organization of Standardization. TLSI is the Clinical and Laboratory Standards Institute. CEN is the European Committee for Standardization. WHO is the World Health Organization. So all of them are providing standards and guidelines. But they are a bit different. Here you can see the 2 major models for quality management system used globally. So the ISO, which is very broad-based, and TLSI is very specific based. So there is set of the standards and guidelines and best practices, and they are tailored specifically for the medical lab testing. And combining these 2 was really challenging for us, but in the same time, we gained from both of the QMS standards in a way that we really improved our processes. In the next In the presented table, you can observe the classification of quality documents and decide which one can fit to your own laboratory scope and to be tailored to your own lab specific needs. Is it clinical or not clinical? And is it international or national standards? So here it's a really good comprehensive guideline for anyone who is just starting and it's getting confused with a lot of requirements. So here you can see who is developing and who is maintaining these standards and guidelines. Our Qatar Biobank quality journey started back in 2012, where we achieved our first quality management system and information management system ISO accreditation certification at 2014. And every subsequent year, we were successful in expanding our scope. And at 2020, we got a CAP accreditation, the most stringent and prestigious accreditation for diagnostic laboratories. We achieved it for our in-house developed custom designed microarray. However, we are implementing all the requirements to our full biobanking scope to maintain the same quality of the samples, considering the Qatar Vision 2030 for precision medicine implementation. So why CAP accreditation and CAP inspections? So here, the benefit for the laboratory is mostly about the laboratory improvement, and the main focus is a patient and the better patient care. In the same time, there is always ongoing compliance with the regulations and with the standards, and it's getting the lab to have an opportunity to stay tuned to the latest requirements. So the checklists are revised every year, and there is more than 2,600 checklist requirements. They are reflecting the best practices, and the CAP accreditation requirements are highly tied to the CLSI guidelines. So that means that they are very specific. So the CAP accreditation cycle is a 2-year cycle where it will be the first external on-site inspection from the CAP expert team, and the following year will be interim CAP inspection, which will be done by the people who are already in the lab. So it's like an interim CAP inspection, and after that, the cycle is repeating every 2 years. As a result of collaboration from a binational working group between the national healthcare provider and the Qatar Biobank, there is a custom designed microarray, and it was developed. It's called SNP targeted microarray. We call it QChip. So what you can see here is a DGDQBB CAP activity menu on the CAP website listing which clinical service we are offering to healthcare provider, the biggest governmental hospital in Qatar, as my colleague Vilma mentioned in her previous module. So this is a great example how the collaboration between biobanks and the healthcare provider can result in achieving the highest quality and the highest care for the patient. The other milestone in our quality journey was implementation of ISO 20387 biobanking standard, where we benefited as a lab from improving our specimen handling, storage, and management of quality of the samples and their associated data. We implemented interoperability, and we reviewed our ethical practices, and in the same time we got a more insights in how to design our quality controls to achieve the fit for purpose requirement in this standard. As you have seen, our laboratory has to comply to various standards, accreditations, and guidelines, and they all have their own specific requirement for the competence of the biobanks or the biorepositories. As you get that comprehensive overview from the previous part held by my colleagues about the quality system essentials, I just want to complete that journey and to focus on the remaining 2 quality system essentials. There is a quality essential assessment and a process management. Laboratory assessment is a very important aspect of quality management system in any organization involved in laboratory testing, research, or analysis. And as internal laboratory assessment is an evaluation of the laboratory quality system and operations conducted by trained personnel within the laboratory or the same organizations. So as you can see here, the internal quality controls are something that it's a daily activity, and it's performed on routine tests which are present in the lab every day with the same lab personnel, and they're leading to precise results. And in the other way, there is external quality control, which can be a program, or it can be the accreditation body who is doing the external quality assessment of the scope of the laboratory. And for the external quality control is specific that it's a periodic and it's a retrospective review of the lab processes. And also it indicates that the laboratory staff areas of improvement or if there is a need to change anything in the quality management system for the quality controls. And at the end, it maintains accuracy. So both of these controls are complementing each other, and the lab can benefit from getting, the precise results, and at the same time we can maintain our accuracy. So the quality system essential for the laboratory assessment for internal one, there are some of the examples what we have implemented in our lab. So we started to evaluate our reagents, so lot-to-lot comparison. That means that we will receive our reagents and we will compare the positive control run on the previous lot and the new lot. Or if we have a same lot of the reagents, but they come in different shipments because, again, the conditions were different, we are going to compare. We have set up the criteria which we will accept or reject the lot. At the same time, in most of the labs, there is something called instrument-to-instrument comparison or method-to-method comparison. If we are having, for example, automation and a manual process for, let's say, DNA quantification, we want to know that in case we have any downtime for the automation, we can easily perform a manual one, and this will not compromise our results. So that's why we implemented periodic review, periodic comparison with set of acceptance criteria between two methods. And if we are having the same instruments, and we have to make sure that they are interchangeable at any time, because we don't know what can happen or what kind of workload we are going to get. So this is one of the measures that we implemented. And in the same time, because of many requirements from our accreditations and certifications, we have to perform a regular periodic audit programs, audit reviews, quality management reviews, and finally we can quantify our success by performing and monitoring quality indicators and key performance indicators. For the quality indicators, it's very important to memorize that there are specific criteria for the standards which laboratory must meet to ensure that it's operating at the high level of quality and accuracy all the time. The important characteristics here that these indicators are specific, and they are test related, and they're measuring accuracy and precision, or they will measure the turnaround time needed for the test completion. And at the end, it's overall efficiency and effectiveness of test method, of the test or implemented test protocol. So here you can see one of the examples that we are measuring. It's called plate metrics. We have a certain criteria that it has to pass 98.5% of all the total samples in that plate. So what we did, we developed a formula, and we set up our criteria, and every quarter we are revisiting our results, we are evaluating and documenting it. And this is going under the management review, and if there is any deviation or any reasons for concern, we will immediately follow our corrective action procedure for accuracy management. And from the other hand, key performance indicators are metrics that are used to assess the overall performance in relation to specific goals or objectives. So what that means? It means that they are not test specific like quality indicators. On the other side, they are giving us idea about overall accuracy and overall reliability of our results. They are easy to identify areas of improvement, and for most of the laboratories, they are used for benchmarking. So what we implemented in our lab, and we took this from the ISPER best practices, is that we are calculating the percentage of the samples aliquoted from the total number of blood tubes received. And we set up our criteria, and we are reviewing it quarterly. And this can tell us about our achievements, and we really can identify some areas where we need to improve if that will be the case. When we talk about the external laboratory assessments, the first thing that comes to our mind are proficiency testing. So the proficiency testing is a is very beneficial for every laboratory because it's ensuring the accuracy and reliability of testing methods. Again, it will identify areas for improvement. It will demonstrate the quality of the laboratory work, because all the results are going to be compared with a big pool of other laboratory results. So we can exactly see where we are standing in comparison to any global network who are performing the same test method. And this will also lead to exchange of knowledge and expertise in terms of the networking. And in the same time, it's going to support the development of new testing methods, which is always challenging. And this is what's going on rapidly in every laboratory. But it's not always so straightforward. So for some of the tests, especially for the biobanking scope, it's not always available, the official PT provider who is having a PT accreditation. So then the lab has to be creative, and there is something called alternative external quality assessment, which is basically a collaboration between two laboratories. For example, the split sample analysis will be just a simple interlaboratory comparison, but the lab who is providing the samples will be used as a reference lab. And that's why there are some factors that I'm going to show you on the next slide, but it has to be considered when choosing the alternative external quality assessment lab that you are going to work with. But the common for both types of proficiency testing, so is it like from the provider or from the other lab, is important that when we receive the samples, the proficiency testing samples, that we are maintaining them in the same way as any other routine samples. There shouldn't be any warning that this is a PT sample and now we have to get serious and to work closely. No, it should be really treated as any other sample, because in this case, and only in this case, you are going to get the real feedback from your process, and then you can take an action to improve that. So for us, we approached two alternative external quality assessment providers. So for the one, it was a US provider, and we enrolled there from 2019. We were good, so we enrolled in 2 PT rounds per year. And also we enrolled with the local governmental hospital laboratory in the same way, and we are also performing 2 PT rounds per year. The important and the common for both is that they should be a CAP accredited, or they should have the same scope and same accreditation that what you are aiming for as a lab. And for the biobanking scope, we approached the IBBL PT provider, and because they have a great proficiency testing programs which are covering a lot from our biobanking scope, and also the frequency is biannual, same as for the other ones. So as you have seen today, the QMS program covers all mentioned 12 the quality management system essentials. So at the last but not least is a process management. So what that means and what it covers. So it means that we need to find the most efficient way to perform and to document all our QC activities. And one of the most important documents here is called the QM plan, quality management plan, which is including everything from the planning, from the processing, quality control, quality assurance, and quality improvement. And it's subjected to annual review. Which are specifics during the developing the QM plan is that we should define all the major challenges, achievements, and define recommendations for the next year. And it should be part of the QM assessment. For now, I will walk you through the QC essentials and how we implemented them in our practice. But before that, I just want to make sure that we all understand what is the difference between quality control and quality assurance. So quality control is determining if the product of the service meets the specification, and the pure definition of the quality control is that it's intended for the detection and correction of significant clerical and analytical error and unusual laboratory results in a timely manner. So basically this is telling us are we okay? Can we continue our operations? Or we have a problem, so we have to stop and revisit and correct before we continue. For quality assurance is something different. So kindly note that quality assurance is not same as quality control, because the activities are not tied to actual performance of the process, and they are offering a retrospective review and analysis of the process, which is in state of control. So in this table here, you can see the comparative view of quality assurance and quality control, and what are the most important characteristics to remember is that quality assurance is a managing tool, a QC is a corrective tool. Quality assurance is always process oriented, and the QC is product oriented, let's say DNA, RNA, or viable cell oriented. Quality assurance will always offer a proactive strategy, so what we can do to prevent. But quality control will be reactive, so we identify the problem and now we have to act immediately. Quality assurance will gravitate toward prevention of the defect, and QC will go with detection of the defect. So there are some important things, and they are both equally important for successful quality management system. So when we come to the quality controls, there are a few things that we have to keep in mind after we understand what is the difference between quality assurance and quality control. So let's focus now about the QCs used in biobank laboratories. So QC is referring to systematic monitoring and evaluation, and its measures and trying to identify and correct any issues or any errors. Quality control will tell us about accuracy, precision, and reliability in our results. We have three main types or three main categories of quality control. So the one will be pre-analytical, analytical, and post-analytical QC, depending on our process. Ideally, we should have a full circle to cover the QCs from the pre-analytical, so from the, for example, from the sample, handling, storage, and transport, then dive into analytical process, which will require quality control samples, calibration of equipment, validations of analytical methods, and post-analytical, which will be some kind of report, some kind of validations. I'm going to show you later on our examples. But before that, if you are on your way to select the best quality control for your scope, for your test, there are a few things that it should be considered before. So we have to know what type of assays are available and what we are going to perform. What about the matrix? That means the background of the quality control. What is its stability? What are the storage requirements? What is the cost? Because QCs can be extremely costly. We have to consider practicability, and we always have, thankfully, a big network and peer-reviewed and many published papers from where we can be creative and look for the best QC that we can implement in our lab and which can really fit our need. I'm going to show you now on the next slides how Qatar Biobank lab has met those criteria. So when we think about the quality control types, there are some commercial quality controls which are usually purchased by accredited reference material manufacturers, and they are split to two main types. CRM, which is certified reference material, and RM, which is a reference material. So the difference between RM and CRM is about this certification part, because CRM will come with the measurement of certainty, and reference material, it will be just like coming with the conformity leaflet. It's extremely hard to find something for biobanking. If we think about plasma or serum or urine or saliva, it's very, very hard to find. But there is another way so that we can still comply. There is something called in-house developed QC. So we can develop our own QCs, and the only thing that is that we have to write them down, and of course we have to monitor them, we have to test them, and then later we have to monitor them. It's important that the in-house QC will, as any other QC, will comply to the 2 mandatory requirements, so that the value will be close to the range of expected results. So we will not compare pears to apples, so we will be in the range of our expected results, and that we will compare the same matrix. So for example, the same matrix like saliva, DNA from saliva or DNA from whole blood, it can have some differences. So that's why it's important to closely specify what kind of matrix is we going to use. And of course, once you enrolled in the proficiency testing or interlaboratory comparisons, and once those PT samples will get their evaluation from the laboratory, you can always keep that sample and use it as your internal quality control, because it will give you a relevance and traceability to the correct result, to the correct value. Here are the examples of our in-house developed DNA QCs, how we are monitoring them. We are following Larry Jennings charts, and also known as Westgard rules. And these are just a set of quality control rules, and with this we can detect errors and deviations. So it's a daily routine process, and it's been reviewed monthly for calculation of coefficients of variations. Once we developed our internal QC or we purchased into external QC, it's very important to keep a track and to keep a log of the sample types, when we start to use it, what is the expiry date, and if there is any QC violation, to document it, and of course to perform a corrective action after that. One of the examples of post-analytical QCs, what we implemented, it's a sample storage validation. So we agreed that we are going to check our inventory, that we will check the physical location with our information system location, the virtual one, and we will compare the location and we will compare the sample condition. We set up the criteria to be around 99%. And we are expecting that 1%, if we don't find it, that we will accept, but we are going to work on its improvement later on. The other thing is, which came from ISO Biobanking, and our compliance to ISO Biobanking certification is a quality report, from where we had to assure to researchers that the biological specimens which are received, that they have been collected, processed, stored in accordance with established standards and protocols which are under our scope. So once implemented, quality control journey just starting. So that means that quality control needs to be monitored and evaluated in the timely manner. It's important to establish the policies and procedures. It's important to know what is going to be monitored, and then to perform a regular review of the QC data. And this is, for example, what we get in our practice. So we are comparing and monitoring manual quantification for DNA, automation quantification for DNA over the years. And we are calculating the coefficient of variation for every month. So we will get a cumulative yearly one. And here we can see some trends that, for example, that we are getting better from year to year, that we are observing a higher difference between automated and manual process, which is, of course, expected. So this trend analysis based on your internal QC plan are highly important and highly effective later on, because it will just give also confidence to the lab staff and to give confidence to the management that we have things under our control and we are providing the best results we can. And another important part, as a part of the process management, is method validation or method verification. So why they are important? So the method validation or verification having the same outcome. So we need to make sure that our protocol or our method are successfully implemented in our practice. And for some methods, there are standard methods available, golden methods, golden standards. They are published and they are easily accessible and everyone can follow them. But also there are some methods which are not standard methods and they are also published, but every laboratory have to overcome some challenges for those implementation. So one of the most important things to remember when it comes to validation and verification is when we are doing them. So validation will always be tied to the non-standard methods or the methods which are modified. And verification is just a simple confirmation of the standard method or the method from the manufacturer. And there are specific cases when the validation has to be performed. So it's usually before the introduction to the method for the routine use. If new method is developed, any conditions which are changing like instrument relocation, a software update, whenever the method is outside of their original scope, or during your QC review you identify a shift or trend, so again it will indicate that method needs to be validated. To perform a validation or verification, there are parameters that it has to be followed. So it will start from accuracy, precision, specificity, sensitivity, limit of detection, limit of quantification, linearity, and measurement uncertainty. Here in Biobank, we are using a great Excel add-in. It's Abacus tool, and it is CA certified, and it's easily applied, and it's avoiding the human error during the stringent and complicated statistical analysis. For the accuracy, it's just important to use a good reference method, a reference material. So it can be CRM or RM or your PT standard, and this will be used as your nominal value. You can use student t-test, f-test, or anything which you can quantitatively express the accuracy in terms of trueness and bias. Accuracy is leading to repeatability. Precision is reproducibility. So that means that it's closeness of the agreement between the series of measurements which are obtained from multiple sampling of the same homogeneous sample under reproducibility conditions. So here it can be changed from the day, from the operator, from the instrument. So it's a very important part of the method validation to assess the coefficient of variation. So why accuracy and precision are so important? Because we can be, as you can see here, we can be accurate but not precise. So we can be precise but not accurate. And what we are aiming for is that we will be accurate and precise. And why is that? Because we want to avoid systematic errors and random errors. Systematic errors are tied to accuracy, and random errors are tied to the precision. So when we incorporate good precision and accuracy strategy, at the end we will reach to high precision and high accuracy in our laboratory tests. Another important parameter is linearity. It's mostly applied for the quantitative methods. So it will talk about the range and dynamic range of the curve, and it will link on specificity and sensitivity, which can be analytical and clinical. Also, sensitivity can be analytical and clinical, and it will be expressed as a limit of detection, so the smallest amount of analyte which can be detected, and limit of quantification is the smallest amount of analyte that it can be quantified with 25% of standard of coefficient of variation. So all of those parameters that I already explained will end with the biggest one, which is called measurement uncertainty. And why is this? Because measurement uncertainty is, as you can see on this fishbone diagram, is obtained, calculated the contributions of accuracy and precision. So everything what we are using and everything related to the method is calculated statistically with the level of confidence 95%. We are using also the coverage factor of 2. And we can express our measurement uncertainty. So to get a reliable result, it's important to consider validation, traceability, and additionally the uncertainty. So for example, if researcher or anyone wants to know what is our measurement of error, we can give them the results of our measurement uncertainty. uncertainty. Here is a validation verification parameter summary where we can see the types of errors, systematic, total, random error, how the performance of characteristics are fitting in with our validation parameters, and how we can quantitatively express any of those performance characteristics. So there is something to think about, that even if you are achieving 99% level of quality, it sounds great, but when you think, it means that we are still accepting 1% of error rate. So how does this reflect on our processes? How every laboratory needs really to find a way to see what is acceptable error rate for their own laboratory. Here I will just show you how we are following the workflow to perform validation and verification. So we will start with the request, where we will define our criteria. We will then develop a plan where we will put all the experiment design requirements, reagents, equipment, personnel, and we will end with the report where we will summarize our raw data and our results, and we will put a statement that is saying that this method is ready to use in routine work. Here you can see some of the examples. So this is our template for the request. So all the relevant parameters will be here. In plan, we will go in more details, we will specify, and we will always link this to any guideline like a TLSI or any peer-reviewed paper or white paper. And in the report, we have to take in consideration different things. So our scope, the characteristics of the required method, appointed operators, they should be trained and competent to perform this task and not to introduce additional bias and variable in your method, validation, types of the samples, how we prepare them, how we store them, what are the working environment conditions, what kind of equipment and accessories we used, and of course, the most important thing is a result analysis, and followed by conclusion, where we will put a comparative table, what we required, what we obtained, and what we are going to accept. With, as I said, very important statement at the end of every validation report that all these parameters were reviewed and approved, and they are ready for routine clinical and research testing. Thank you once again to give me this opportunity to present our quality journey. And now I'm ready and happy to answer any questions. Thank you so much.